Hi there, this is Andy Green from Reflex Chiropractic in Caversham, Reading, with the latest of our rehab exercise videos. This is now the Psoas muscle stretch. So it's your hip flexor is your biggest, or the Psoas I should say, is the biggest of the hip flexor muscles, and it's often a muscle that gets very, very tight. So the first of the positions, because it's quite a complicated stretch this one, so hopefully the video will be really useful, is we go into a split squat, so one foot in front of the other. And in that position there, it's really important that you must keep your pelvis level. If you are very tight in this muscle, the temptation is for the front of the pelvis to drop forward and make it more comfortable in that position. So we have the pelvis level, and you can, if needed, slightly bend the front knee, but it's not essential for this. And then the side that we're stretching is the leg that's going backwards. So the right arm, in this case here, we're going to stretch up to the ceiling, not in a sort of a limp way, as if you're really keenest person at the back of the class, really stretching it up. Then from the hips, we're going to lean away from the side you're stretching. So away from, in this case, the right-hand side. And now we rotate towards the side that we're stretching. So in this case, we're rotating again towards the right. And we would hold that position for a good 20 seconds. Before repeating on the opposite side, and we repeat either side 3 times. Now if you're not feeling a suitable amount of stretch on this, you can make the initial squat wider, so front foot wider, and also you can allow that front knee to bend a little bit more, but you must keep that pelvis level. One of the contraindications for this is if you're doing the stretch position, but rather than feeling the stretch in the front of the groin area, if you're feeling pain in your back, please stop and refer to your practitioner for further advice to check you're doing it correctly, or whether there's something else going on in your back that needs to be eased, and whether this isn't the right exercise for you to do at the moment.